back with social infrastructure health, and in this we are going to talk about what are the problems, or what is ailing the health sector in India. Or you can get a question as healthcare in India continues to be a challenge. Discuss. So in this, what are you going to discuss? We've already talked a lot about it. Of course, it is the inequitable distribution between existing health, between the rural and the urban, the health infrastructure. There is this what is known as GBD, that is high global burden of disease. Then you have these communicable diseases which are still there. Poor state of the primary health centers. The health centers are not up to the mark. Then you have poor upkeep and maintenance of these places, and privatization has come up, which is very expensive, and the health care for the poor, uh, they rush to these government hospitals which they know are not up to the mark. And of course we spoke about poor women's health, and we talked about poor sanitation. So just go through this. Well, we can just I can just talk a little bit about this. So problems of health sector in India, that means we have, it's not denying the fact that we have not built up a health infrastructure. Of course, we have built up a vast health infrastructure over the years since independence. However, these are some of the problems that our health sector still face, and there's so much to do in this area. One is, we can talk about the distribution of our existing health infrastructure is inequitable. Most of the modern health facilities are available in the urban areas. Health facilities in rural areas are very less. They're inadequate, not up to the mark. And for example, about 70% of India's population are in rural areas, but only 1/5 of hospitals are located in rural areas. So that kind of inequity, that kind of distribution that we see, which is so inequitable, unequal distribution. So then we also see what is known as GBD, that is high global burden of disease. It is an indicator used by experts to measure the number of people dying prematurely due to particular diseases, as well as the number of years spent by them in a state of disability owing to the disease. Then you have India bears about 20% of the global burden of disease, which is really a thing to be worried about. Then in India, more than half of GBD is accounted for by communicable diseases such as diarrhea, malaria, and TB. And every year around 5 lakh children die of waterborne diseases. So you have, then talking about communicable diseases, they are like AIDS, AIDS, that is acquired immune deficiency syndrome. Then you have what is known as HIV, that is human immunodeficiency virus. And then we also have SARS, severe acute respiratory syndrome, are raising and posing a serious threat to the society. And as if this was not enough, we have what is known as the COVID-19. Another thing is, like, which we find as problems of health sector in India, is poor diet. Poor quality of diet is a threat to public health in India. We do have around 15.2% of the world's total undernourished people who live here. Then we have what is known as a poor state of primary health centers. So 38% of the primary health centers have the required number of doctors. Only 30% of the primary health centers have sufficient stock of medicines. So 38% means if 100 are needed, only 38 are there. You can imagine. So then we also have a poor upkeep and maintenance. So even especially the government healthcare centers, the upkeep and there has to be maintenance, which is not going on. That is very poor. And that is why the quality difference between private and public hospitals is so huge. That is why people are compelled. Nobody wants to go to the private hospitals because of their whopping costs. But what to do? They have to because of this. Because of this, government healthcare centers are not up to the mark. So healthcare for the poor, what happens? At present, less than 20% of population utilizes public health facilities. So what happens when poor fall sick? So some of them have to sell their land or even pledge their children. You can't even imagine. They pledge their children so that they can afford treatment. And because sufficient facilities are not provided by government run hospitals, the poor are forced to go to private hospitals and get even more indebted forever. Either they get that indebted forever or they die. That's a clear horrible option that they have. Then you have privatization. Of course, the government is moving towards privatization of healthcare facilities, and but healthcare is becoming increasingly expensive because of this, and it is getting beyond the reach and of the poor, the middle class. It's very difficult. At present, less than 20% of population utilizes public health facilities, and the remaining they depend on private hospitals. Even though they don't want to, they have to. Then there's nothing left. They see Jaan hai, Jahan hai types. Then you have poor women's health. We've just talked about this in the last class, and really, I mean, women, first thing, women's health is compromised, and forget about women's health is compromised. Women themselves are tuned to overlook their health, which is not a good thing. She should know that only if she's all right will she be able to manage the family, will she be able to look after the family. So what could be the measure if we look after all these, we take care of these points, for sure we will bring about some changes in the healthcare system in India.